Putting pen to paper. Some of the nearly 200 pieces of legislation signed Wednesday by Governor Wes Moore will go a long way when it comes to cancer detection and treatment.
Some of my patients have had to refuse the additional exams that they needed because they couldn't shell out $500 or hundreds of dollars at the time of the ultrasound or additional mammogram or MRI.
This is huge, especially specifically when we talk about emphasis on underrepresented communities. Having the opportunity to be able to afford to have follow-up care.
Starting next January, insurance companies will be banned from making patients cover a co-payment, co-insurance, or deductible for diagnostic imaging associated with lung and breast cancers. Those screenings can lead to early detection and save lives.
The earlier that we detect either one of those cancers, the better the outcomes for the patient, first and foremost, and then of course it lowers the overall cost of care to our health system by identifying and treating these cancers early.
According to Johns Hopkins, approximately 10,000 Marylanders died of cancer in 2017. 24% of those deaths were from cancer of the lung and bronchus, and 8% were from breast cancer. Medical experts say follow-up care is key and can decrease those numbers.
People do not understand the impacts of having a diagnosis that may be positive. And when it comes to your preventative care, timeliness is everything.
So true. And part of this legislation includes requirements for the Maryland Department of Health that must assess current outreach, education, and health disparities in cancer screenings and make recommendations for improvements.